All right. All that is left is a faint memory based on what a strange melody. All right. So I guess you have an idea of what we'll be speaking about this morning. We want to find out what happens to your loved one. What happens to your loved one when he or she dies from COVID-19 related complications? And you have the same kind of send off? This morning to speak with us about it is Managing Director of Simpson's Memorial Limited, Mr. David Simpson. Good morning to you, Mr. Simpson.
Good morning, Natalie. Good morning, Trinidad and Tobago. It's a
And
pleasure
thank you
to be
so
here.
much for joining us this morning. I know that, especially during this time of the pandemic, things have changed drastically in how we're able to say our final goodbyes to those who we've lost to COVID-19. So let us start with how how is a burial different now compared to before?
Well, Natalie, the protocols are a bit harsh, Some may say a bit inhumane, when one die of this virus, this disease at this point in time. The funerals that take place for these bodies are very limited in number, so you can't have a whole family. The protocol right now set by the Ministry of Health is 10 persons that can gather to say goodbye. Now, think how hard that will be for a family who has um, 15, 20 persons, or 25 persons, and in some cases more, uh, unable to say goodbye. What has to happen
Yeah.
then? We now have to find innovative ways. We have to do Zoom, we have to do Skype, you have to Facebook Live, Instagram Live, so that the others can attend and still say goodbye without being there. So
Yeah.
actually, it's
So family
virtual.
members have to be picking and choosing who are the most important to come to this funeral, more or less.
Yes, that's right. You
And
have
one of
to
the
protect us
things,
with
one
this.
of the traditions with burials is that we normally get, to view the body. We normally have a period of viewing the body, standing by the coffin, looking. I did it with my grandmother, but are people able to do that now?
No, unfortunately, that has been stopped. You now have to use pictures, and it's now all memories. So we have to do accolades where we put up pictures of the person in life on screens, have it rotating, have pictures, portraits placed on the casket or on an easel next to the casket so that persons can have a visual. But as far as seeing the physical loved one, no, that can't take place at this time.
So, I mean, how do we know who we're burying then? How do we really know that this person is our loved ones? We can't get to view the body at any time after death. So, how do we really know?
Well, what happened at the beginning of the pandemic, when it was the P1 strain, we were given permission to open the pouch for 30 seconds that housed the body, the loved one, and you are able to take a picture or a 30-second video so that you can verify, yes, that is your loved one. It is one of it's close to humane. At least you could connect and say, yes, that is my loved one. I'm satisfied that the person that I'm interring or cremated is the said person in the casket.
But you don't have that luxury now. So, it's just have to trust the process. But you at the funeral home would be able to say if it's X, Y, or Z.
Well, to some limits, we do allow the funeral home staff to take that picture and still share it with the family.
Okay.
We have to be humane. We have to understand and not try to make it worse. We have to try to at least give some sort of ease. That is what we as funeral directors supposed to do. Ease the strain and the stress from the family at this time of grieving.
And I know that according to religious beliefs and practices, even cultural practices, some people may opt for a burial and some may opt for a cremation. Are we still allowed both with bodies, with people who died from COVID-19?
The Muslims were allowed to bury, and everyone else had to cremate. But now the Karapo cemetery, and there's a cemetery, as far as I understand, and they're coming on board. We didn't get the name as yet, but we are now being allowed to bury. It started last week, so it will be continuing on. So now families have the option to bury or cremate.
So what was it that prevented this from happening before?
I think they didn't understand the virus quite as yet. So, Trinidad has a very high water table. So they wanted to be sure before we put this virus into the ground that we understand what is going to take place scientifically. So now they understand slightly that it's not spore forming, so it's safe to enter.
Mm-hmm. Well,
We
I
wouldn't
don't know.
have
So
a situation
before
like
everybody was the same process?
it's the same process, but as far as PPEs, the way the cremains are handled and the protocols that has to be taken, it draws up extra costs. Just the same way as the funeral. We in the funeral industry, the price is elevated somewhat because of the amount of PPEs, the protection that you need to have, the protocols you need to follow will drive up the cost. And for some reason, I don't know, during the pandemic,
Yeah.
prices for PPEs and everything that we will need to provide care has escalated.
And you
So
spoke about Mukarapo Cemetery, being on board to bury people. Is it that other cemeteries were choosing not to have COVID-19 bodies in their space?
not Mukarapo, Karapo, the Karapo
Karapo,
Cemetery.
sorry.
Yes. It's, the corporations, when they receive their memos from the Ministry of Health and the health department of the corporation does their research, then they are able to give the protocols on how to proceed forward. So it's not that we could just go to the cemetery. All the cemeteries are governed by the corporation. So as soon
Right.
as we get permission from the corporation, we can go ahead. And that is what has been done.
Now, I know that Simpsons Memorial Limited is the funeral home that treats predominantly with COVID-19 patients. Is it that you are liaised with the ministry and then if the family chooses, it can go on to another funeral home? How does it work?
Okay. We are one of the funeral homes that handle COVID-19 bodies. There's a list of us, and we actually have an association, and there's a list. So persons not wanting to use our services, depending their geographical, position, they can choose another funeral home. Once that funeral home is on the list.
Right. So that list is what approved by the Ministry of Health to say these are the funeral
Yes.
homes that are, I don't know, registered to deal with COVID-19 bodies. What's the difference between the people on the list and those who aren't?
Okay. The people on the list are persons who have qualified mortuary staff. They have qualified embalmers that have been classically trained to handle such cases. What we have to do is, as funeral directors, we are to protect the public health. When you go to mortuary college, the first thing they tell you is that we are protectors of the public health. So you want to have that casket properly sanitized. You want to make sure the care that should be given is given, no corners are cut, and we make sure that when we present to the public to say their final goodbyes, that no one carries home an infection, a germ, or any part of that virus.
And what are the risks to the people in the funeral home who have to treat with these bodies? Do you all still embalm people? Is that just a part of the natural process of treating with the dead?
In the COVID protocols, no, unfortunately, we are not allowed to embalm. We have counterparts in the US who have embalmed and they are now deceased.
They're now
So
what?
they are now deceased. So caregivers to the dead are deceased because of the virus. In Trinidad, it's not that bad. However, we still have to maintain the same protocols and we need to protect our employees. We need to protect the public, sorry. And so the protocol right now is that no embalming, no viewing of that sort. There is some disinfection and there is some protocols that we follow at the mortuary that was approved, and that is the protocols we take.
And have we had any COVID positive persons coming out of funeral homes, or have we been able to, do the right thing so far and keep the numbers, as in, not getting spread outside of funeral homes, inside of funeral homes? Sorry.
There, to date, there is none on register. to say, well, a funeral home employee or funeral home operator and his staff has been infected. Thank God so far. So it means we are doing something right.
And yet we've had doctors and nurses who have been infected. So tell us what it is that you all do to ensure that you stay safe. Just a little snap, synopsis of how you treat with it, from picking up the body to putting it in the grave or the crematorium.
Yes, very well. As well, at first, I want to thank our frontline health employees who put themselves on the line. Their work is a little more strenuous than ours, and we want to acknowledge them at this time. So, when we give care to a COVID-19 patient, the first thing is PPEs. We have to protect the individuals that are going to treat with this loved one. There is disinfection, there is fumigation, anti-static at that some of our colleagues and persons operating in the industry do before we go into the room. It's isolated where we're going to operate, right? We also try to operate within a certain time frame so that the any chance of leakage, any chance of coming into contact with the virus is very, very small. Full PPEs, fumigation, following the protocols, we put that body into the casket. That casket is fumigated on the interior. The handles, the hardware of the casket is sanitized. The casket is locked and sealed, or as we say in the industry, then it is presented at the chapel. We usually use ropes around the casket or some measure of distance so that we wouldn't have any sort of contamination that could take place. We understand to a point that this virus might be airborne. So sometimes we make sure and shut down the AC in the building depending on the situation.
Well, Mr.
The
Simpson,
family,
what I'm hearing is that, for the person, as you said, funeral homes are there to help the grieving members of the family. But what I'm hearing is you have to pay more to bury your loved ones. You can't necessarily see them. You can't touch them. A lot of you can't be in the space, but it's costing you more. How is that helping them to cope?
well as anything else in where we have to do what we have to do. It may seem or sound inhumane, but when you understand the processes that go in to presenting a COVID-19 case, then you have a better understanding. Well, listen, PPEs have to be paid for. Where in a normal situation, there's a level of protection, but it's not that high. When you present at the chapel, again, you have to make sure that you have the correct environment in which to present. So yes, there's a cost there also. So,
All
but
right. But talk to us about how the family members of those who've died from COVID, how from your experience and seeing them, how have they been, responding to all that is happening? The fact that most of them can't come to the chapel or even whether it's the crematorium site or the burial site to see their loved ones. They can't get that kind of interaction, to get the final goodbye, as we like to say, and to get closure as we normally look forward to in a funeral. How have they been reacting?
they have been coping. It has been hard in some cases, I must say. I must be honest. Sometimes it's a bit heart wrenching to see, persons on the Zoom or on the live, sobbing. But we have to protect them, and we have to do what is necessary to protect our public. So
Yeah,
that
and
is
yet
why,
I agree with you, but here my logic. We
Mhm.
are we want to protect them, but somehow people aren't getting, to me, the severity of the situation, because people are still choosing to lime, to gel together, to gather in their numbers, not understanding that when that person dies, you can't even hire a professional mourner to come through.
Yes, that is true. Um, you know, I want to say sometimes you have to see if it was possible, probably to bring the cameras into our space and where we operate, and persons actually see for themselves. Hey, listen. This is how this is done. So it is no longer traditional. We can't embalm. We can't give the type of care, whether you hair, nails, and makeup, whether we get the barber to come and give you a last mark and stuff. No, that can't happen. We cannot
So
open your casket.
whatever state you die in, you have to stay in that. Do you all remove the person's clothes, or you all just, if you were in a gown, you go to the grave in the ground or go to the crematorium in the grave? Do you all do all of these things, or just no? It's just a matter of just putting the body in a freezer until it goes to a box, or to the and just do away with it.
At this time, disinfection and the sealing of the casket.
That's it.
Yes.
So no dressing up the person, making sure hair is right. People tend to wear the best dress or suit when they die. None of that can happen anymore.
Unfortunately, at this time, that is prohibited.
So then, should we have the funeral homes be a part of the press conferences to explain to people that if you die from COVID, this is what is going to happen to you? That last dignity, that last right, that last mourning, that 90% of that is absent, because I think we're still getting the numbers. Yesterday we had over 600 and we are seeing more people dying. Why are we still even having these numbers? Is it a lack of understanding of what happens, you think?
I think it's just persons, because it's not the Trinidad alone. I mean, I remember in the first lockdown, we were seeing persons in Texas and persons in Miami still partying and stuff in large numbers. So it's persons understanding what is taking place. There are conspiracy theorists out there that say this is a situation that was developed by persons, population control and stuff. So it all depends on how you decide to keep yourself safe.
Yeah,
At the
but
end of the
at
day,
funeral homes, have you all done any kind of advocacy, any kind of, just having this conference and saying, listen, people, this is what happens when your loved member, even you, die from COVID? Is this really what you want? And try to explain to them, because I think a lot of people don't understand, that if you're in a tear up drawers, you're going to the grave in the tear up drawers. There isn't any such thing as, as you say, that dignity that is normally, that reverence that's normally given to the deceased, that all of that doesn't exist right now.
that's right. And again, I said, if we were able to bring the cameras into our professional space, probably the visual.
Have you advocated for that?
No, it's not protocol, I would like to say. Remember, when you go, if you're a surgeon and you have to perform a life saving operation, you wouldn't bring the family in there. Some of your maneuvers might not sit well with them. So, in the same way, the same respect is given to a mortuary.
But should you advocate for that? Should you advocate to the Ministry of Health for that? Because maybe if people can really see, as you say.
I don't think we have to advocate, because persons have been viewing funerals and they would have had loved ones that would have passed, and they were told wouldn't be on the list, you were unable to attend, but you could attend via Zoom, via Skype, via Facebook or Instagram Live. So that in itself should be a culture shock to know, well, should in case my mom dies and she has 12, 15 children, which is the 10 that are going to be there in person, and who is the rest that is going to stay on the outside?
And that's a serious ethical decision to make.
That's right. So then
we don't have much time, but I really wanted to take some calls on this issue, because I know a lot of people might be curious. They might have questions that I don't have. So we do have Pleasantville on the line. The number to call is 622-4010. Pleasantville, good morning to you.
Morning, Natalie. Morning, David.
Pleasantville, can you hear me?
Yes, I can hear you, Natalie. Can you hear me?
All right, if Pleasantville is speaking, I'm not hearing the person. 622-4010, we can try this again. Let me see if we have any messages here, because I know that for me, I was so curious, about what happens to that person when that person dies, because we just don't know. And the thing is that I've been begging my parents, like, don't die during COVID, don't die during COVID, like literally, because, we have to operate business that you interact with the public so often, and I get so nervous for them, but all right, let's see what's going on. Good morning, guys. In Tobago, some funeral homes are charging as much as $28,000 to bury COVID-19 person. What's the average price though for a COVID-19 person? Is it based on the casket?
Families still want to give their loved ones a certain type of send-off. So sometimes you may hear exorbitant figures, and that is because some families choose to go as natural as possible to the normal what they understand. So they will have portraits, they will have videotaping, they will have the YouTube. You know, some choose to go with a more expensive casket to show their love. Well, listen, this is mommy or daddy still, and we think even though they die of COVID-19, they should be handled in this
So what's
manner.
the average cost? Because I don't know. I've never died before, thank God. What's the average cost for a COVID-19 funeral?
It could be anywhere in the vicinity of 12 to 15,000 on one end. And if you're going to do the cremation and you're going to have the full works, you know, you're going to have the accolades, you're going to have full color programs, you're going to have
so all the extras. How much would the extras cost us?
Well, it varies from company to company. But again, I think that will not be doubled. So whatever the initial cost is, that is what you pay. But be prepared to put out around $10,000 to $15,000.
Yeah.
Right?
All right. Pleasantville is asking, thanks to the director, she sent the message to me via text, if you can take away the ashes after you've cremated the body.
Yes, you can. Yes, you can.
Okay.
The ashes is given back to the funeral home, which it poses no threat.
Well, one texter on the number to text is 326-7285, and this person says, good morning, Natalie. Could you ask Mr. Simpson whether COVID bodies are separated from non-COVID bodies?
Yes. Hence the reason certain providers are given the opportunity to serve at this point in time. There must be a clear demarcation where you hold the COVID bodies as against the regular clients that are going to be there at your business place.
Okay, so you can take away the ashes. Nowadays, you can do a 30-second viewing. Just some of the things that we want to ensure we get out of this interview. So you can do a 30-second viewing.
Now, understand, this 30-second viewing is not public. This is one member into your...
All right, you have to repeat that because we did lose connectivity.
Yes, someone called it. One member of the family dressed in full PPE to come to the funeral home and do a 30-second video or take some pictures. That's as far as that goes. There is no other viewing besides that.
Oh, and they have to be in full PPE to do that.
Yes, that is the protocol. And remember, again, we have to protect the public. And it's from a social distance standpoint. So you're not going to be up on the honorary. You're going to be 6 feet away. So you have to use the Zoom on your phone and make sure and get your pictures and your video. In some cases, when we explain, the families ask us to do the video and have it sent to them. So I do think people understand to a point what actually goes in. And the persons who have experienced COVID-19 funerals could attest to what the situation is. So I think by and large, Trinidad is call us a party nation, you know, but this is not a time to party. It's a time to sanitize, wear your mask, social distance, and stay safe.
Mr. Simpson, I really want to thank you so much for giving us such clarity on what happens when somebody dies from COVID-19. You all continue to stay safe, wear those PPEs, and I think just tell people listening, if you don't have the 15 to 30,000, don't die.
No, well, we will still make sure that everyone has a decent burial.
Yeah.
So even though the prices you can't make the higher end, we will create an opportunity in which you are able to say goodbye.
All right, Mr. Simpson, thank you so much. We appreciate you.
You're very welcome. Have a pleasant day.
All right, much more coming up in this morning's No Morning Show program. So do stay with us. We're going to take a short break.
Every year somebody did.